Hello, Mrs. Smith. What brings you to the doctor's office today?
Well, I haven't been feeling like myself for like a long time now. Like over the last 3 months, I've gained 26 pounds and I have no energy ever and I just don't feel the same.
Okay, I'm sorry to hear about that. Have you been having experience like fluctuations recently?
No, I've always been really active. Like I am a runner and I used to like to eat healthy, and now suddenly I have no energy to do anything, not walk the dogs. Like just getting up to go to work is a struggle every morning.
Oh, really? Have you had any recent problems with depression or any mood changes?
Well, honestly, like I haven't been feeling depressed until recently. And I know it's because of all these body changes and changes in my energy. Like I don't eat anything ever and I'm gaining all this weight. And I just feel like I'm turning into an old lady. And I'm just depressed because of all this sudden aging.
I'm sorry to hear about that.
I just don't know what to do.
I'm sorry to hear about that. Can you like expound on your sudden aging? What do you mean by that?
Well, so like for one thing, like I'm always cold. I can never get warm. And then like my skin is always dry and it looks wrinkly and my hair is thinning and look at me. Like I look terrible. And like my hair's thinning and it's going away and also, this might be too much information, but I have been constipated for like 3 months now, and like I cannot have a bowel movement without a laxative. So I just feel like I'm suddenly old. I'm only 35.
Oh, I'm sorry that you're experiencing all of this.
Yeah.
Have you had any thyroid tests done recently?
No, what's a thyroid test?
It's just a simple blood test. They'll just check your thyroid level so your doctor can know what's going on with you.
Okay, I've never had that done.
Okay, well, it's very simple, so.
Okay. Well, there's one more thing you might want to know. I don't know if this would have anything to do with anything, but I've been having really heavy periods with really intense cramps for a long time. And my whole life I've had regular periods, and now they're really heavy and they last more than a week. And I don't know if that has anything to do with anything, but that's just another thing.
Well, it's good you told me that because that can be related to your other symptoms. So I'm glad
Really?
you told me that, yeah.
Okay. Thank you so much for your help.
Yeah, no problem. I'll just go get the doctor so we can do the blood test, and I'll be right back.
Okay.
1.
This patient is experiencing signs and symptoms of hypothyroidism. It is mostly caused by an autoimmune disorder where the immune system destroys thyroid cells, and the most common type is Hashimoto thyroiditis. It occurs primarily in women. Signs and symptoms of hypothyroidism include weakness and fatigue, weight gain despite loss of appetite, dry brittle hair, cold intolerance, menstrual abnormalities, and dry, rough skin. Risk factors of hypothyroidism include women, especially those older than 60, genetics, family history, and thyroidectomy.
Hello, I'm back. Hello. Your blood glucose came back and your doctor has analyzed it. It shows that you have low T4 levels and high levels of TSH. Okay, so your doctor has diagnosed you with hypothyroidism.
Oh my gosh. What is that? Is it treatable?
Yes, it's very treatable. So you're just going to have to take some synthetic T4, levothyroxine, and make sure to take at least half an hour or 60 minutes before you eat your breakfast in the morning.
Okay. So I might be back to my old self again?
Hopefully. Your symptoms should decrease as you take your medicine, so you should feel more normal as time goes on.
Thank you so much for your help. I
You're
feel
welcome.
better already.
Do you have any questions for me? Okay. Just call if you have any question or anything.
Okay.
Okay.
Hypothyroidism can be diagnosed with lab values including low serum T4 and elevated TSH. And treatment includes synthetic thyroid hormone, or levothyroxine, which replaces T4.
Hello, Sion. What brings you in today?
Hi, so I and my husband, we're trying to get pregnant, and then finally it's happening. It's been 3 months since I got my period, but I've been taking a pregnancy test at home, but you know, the Walmart machines, right, the pregnancy tester ones, it's coming out negative, and I'm just kind of worried. That's why I'm here.
Okay, we'll make sure to do some general assessments. I can see by your vital signs that your BP and heart rate are slightly elevated. And so I see that your eyes have kind of started to protrude, and it seems that you're having trouble blinking. And so that seems to be a cause of concern for today.
Oh, I'm always hot. I'm always hot, and my heart is always like crazy. And yeah, my eyes. I think it's just the eye makeup that I'm using right now.
Okay, I'm just kind of curious if your eye makeup has ever done this in the past. And I noticed that you're sweating and you seem really uncomfortable right now.
Yes, I'm always hot, like I told you, but no, my eye makeup has never done this to me before.
Okay, have you ever had your thyroid levels checked, or have you noticed any change in your appetite or anything like that?
Oh, yes, you know what? I'm 3 months pregnant and I lost almost 20 pounds within the last few months. Isn't that cool? Like, you're pregnant and you're skinny. And yeah, I have very good appetite. Actually, speaking of appetite, I'm so hungry. I'm gonna eat something.
Okay. So just another follow-up question. I guess there might be an issue there because you seem to be losing weight even though you're eating a lot. And so I just kind of want to ask, I noticed that your throat has kind of started to swell up a little bit. Do you have any comment on that, or kind of a history of that?
Yeah, I kind of have like difficulty swallowing, but I don't know what's wrong with me.
Okay, can you just kind of demonstrate that swallowing for me? Okay, and have you had any issues with your menstrual period or anything like that?
Oh yeah, I have very irregular periods. Is that not normal?
Well, if your period has changed recently, that would be a cause for concern, and we'll kind of do some more hormone assessments for you.
Yeah, it's pretty recent. And nurse, by the way, my leg, it gets swollen, and I think it's the pregnancy. My sister was pregnant. She like always get swollen feet, and I think it's just a pregnancy symptom.
Okay, we'll definitely run some more tests, and I'll take a look at your feet, and we'll kind of determine whether or not pregnancy is involved. Okay?
Okay.
Hyperthyroidism is an endocrine disorder caused by high levels of thyroid hormone in the body, which results in a high metabolism. The common causes of hyperthyroidism are overactive thyroid gland, which results in high levels of thyroid hormone in the body, also known as Graves' disease. It can also be caused by pituitary tumor or goiter. Some of the common symptoms due to hypermetabolism tend to be tachycardia, the patient always being hot, large appetite but still losing weight, nervousness, restlessness, and anxiety, amenorrhea, and exophthalmos, also seen as protruding eyes.
Hello, Sion. We're back with your lab results.
Hi. Tell me the good news. Tell me the good news.
There isn't any.
Okay, Sion, so your healthcare provider has diagnosed you with hyperthyroidism. Some of your labs have showed a low TSH level at 0.1 instead of that normal range of 0.5 to 6. And your thyroid has been overcompensating to incredibly high levels, which has unfortunately shown in your serum thyroxine levels at 25 instead of 4.6 to 12. And unfortunately, you are not pregnant. More specifically, Graves' disease is common among women ages 20 to 40, and it accounts for all your symptoms that we kind of talked about earlier.
Wait, did you say I'm not pregnant? What's Graves' disease? Okay, I'm pregnant. See, I am pregnant.